Hi, everybody. I'm Dr. Sheppard with Align Family Wellness. Welcome back to our Facebook page or our YouTube channel or our podcast. Today, we are going to be talking to all of our mamas out there who are in our care, waiting for their precious little baby to be born, but you don't know what to expect after baby's here as far as getting adjusted. So, we want to talk to you today about a sneak peek about why you should be adjusted after having a baby. So, for starters, you basically just ran a marathon after you had your baby. So, wouldn't you think marathon runners train really hard, then they run their race, and then they're just like done? No way. They have a detailed, massive recovery plan. And that's what we want for you too after your baby is here. We want you to have a detailed recovery plan and us part of your team. You spend months preparing and training for birth, creating this perfect registry, getting all the books, having a birth plan. But when your baby is here, you're overwhelmed, you're exhausted, you're depleted, and nobody has told you about how horrible the postpartum period actually is. Then you throw on breastfeeding issues and challenges with that, and it is just exhausting. And so, while most of the resources focus on labor and delivery, the reality is that the fourth trimester lasts far longer and receives just a fraction of the attention and support that the first three do. And I can probably tell you from experience that that fourth trimester is where we need the most support and we need the most love and the most help. So, this video is for new mamas who are struggling with physical recovery, sleep difficulties, breastfeeding challenges, or having just emotional troubles during your postpartum period. And you are wanting natural support to help your body recover and feel better. So, being part of postpartum chiropractic care is crucial for both mother and baby's nervous system health. So, we're going to learn today about how birth related stress can cause some subluxation within babies and how these imbalances contribute to postpartum challenges in moms, also, and how gentle, specific treatments for people who are trained in postpartum care, which is us at our office, we can help restore proper nervous system function, create a foundation for healing and for bonding during this critical time. And don't forget, I am an internationally board certified lactation consultant. I have another board certified lactation consultant and a certified lactation consultant in our office. So know that we are qualified to help you during this postpartum period, especially for any issues with baby nursing, pumping, transitioning back to work. We are here for you, mama. So let's look at some of the stats. It's estimated that approximately 10 to 20% of moms experience postpartum depression. So this is a significant public health concern, yet it only represents the most severe end of the spectrum, the actual postpartum depression. The reality is most new moms feel unprepared and they can't adapt to the physical and emotional challenges following childbirth. 70 or 80% of moms experience baby blues. And we feel guilty for feeling that way. But when you have a 6-week maternity leave and your spouse or partner gets 2 days off of work and you don't have family around, this is hard on these mamas. And so what is just more concerning is the physical toll of birth doesn't go addressed. Research has documented that during delivery, a baby experienced significant compression and twisting forces over their neck and birth canal. The pressure reaches from 10 to 500 millimeters on the baby's neck and head. An extraordinary amount of force on such a delicate structure. These same forces create physical strain on mom's body too. You literally just pushed a 5 to 8 pound child out of you. That is extremely difficult. Some of you are pushing for hours and hours. And just the whole, prodromal labor or active labor process is just really physically demanding. So let's talk about what really happens to your nervous system during birth. Like we said again, birth is a marathon. It's physically and neurologically for both mom and baby. Don't forget what happens to baby. For moms, labor and delivery demands extraordinary physical exertion, with your body producing complex hormones while experiencing intense pressure, stretching, and even tearing of tissues. These physical and emotional stressors can create what we call subluxation, which are areas where the communication between the brain and body get compromised. So for mamas, subluxation usually occurs in the pelvis, the lumbar spine, and the upper neck and the thoracic, everything affecting from core recovery to hormonal regulation. It makes sense. You've pushed, you've carried a child within your pelvis. It's going to be sore afterwards. So there is this postpartum hormonal cliff that we go off of after we have a child and its impact on our neurological system. So within 24 hours of birth, your estrogen and your progesterone levels, which are the hormones that are elevated during pregnancy, plummet dramatically. This abrupt hormone transformation is often described as falling off a cliff hormonally, and it is profoundly impacts your nervous system. These hormones don't just affect reproductive functions, but they directly influence neurotransmitters in your brain and balance of your autonomic nervous system. So when your nervous system becomes dysregulated during this hormonal fluctuation, it can lead to difficulty sleeping, anxiety, temperature regulation, you're hot, you're cold, digestive issues, and just really being emotionally sensitive. So the mother baby connection with our nervous system is really important. So the connection between you and your baby goes far beyond the emotional bond. It's a profound neurologic relationship called co-regulation. So your baby's immature nervous system relies heavily on your nervous system for stability and organization. Studies indicate that babies depend on close contact with their moms to regulate their heart rate, their breathing patterns, their body temperature, and their stress hormones. So when mama's nervous system is balanced and regulated, baby tends to calm more easily, feed better, and just feel more secure. But when we experience hormonal and nervous system dysregulation, our baby exhibits signs of distress, which creates a challenging cycle. If mom is stressed, baby's going to be stressed. So how do some of these common postpartum challenges connect to your nervous system? Well, first and foremost, I'm an expert in breastfeeding, and breastfeeding difficulties involve nervous system function, particularly with the letdown reflex, which depends on optimal vagus nerve activation. You have to be able to get in that rest and digest part of your nervous system to have that letdown response happen. Plus, the baby itself uses 5 cranial nerves and over 30 muscles to be able to nurse on you. So if there's any stuck tension, baby's not going to nurse well. Sleep problems, they are a universal postpartum challenge, but they are directly connected to your autonomic nervous system balance. So if your nervous system is stuck in fight or flight mode, it makes it difficult to relax and get restorative sleep, even when you're exhausted. So postpartum mood challenges represent the most significant intersection of neurologic, hormonal, and physiologic factors. Physical recovery is part of this. People will have pelvic pain, upper neck pain. Some moms will just, really be sore. They can have diastasis recti. And that is just beyond simple healing. So how does neurologically focused chiropractic care support you in your postpartum journey? So our approach begins with our insight scans, and they tell us objectively what's going on with your nervous system. These scans are a window into your nervous system, allowing us to pinpoint exactly where and how subluxation is affecting your neurologic function. Then we do gentle and specific adjustments to help restore your pelvic function, reduce tension in your cervical spine, and enhance your nervous system to help your hormones balance, help you sleep better, and just help you feel better, and also help you nurse better. So for the baby, the gentle pediatric adjustments are so helpful in, being able to release birth-related tension, help them nurse better, help them sleep better. And the pressure we use is literally light and precise, and it is comparable to testing the ripeness of a tomato. So if you are curious about this, if you want some postpartum support, if you want someone to walk you through this, click the link in our bio or head to our website and schedule a new patient appointment and get your postpartum neurologic assessment. We would love to take care of you, mama, and your sweet new baby during this 4th trimester.